Clopidogrel is used to lower your risk of having a stroke, blood clot, or serious heart problem after you've had a heart attack, severe chest pain, angina, or circulation problems. How to use? Clopidogrel is taken orally, regardless of food intake. For the prevention of ischemic disorders in patients after myocardial infarction, ischemic stroke, and diagnosed peripheral arterial disease, 75 mg one time per day. Treatment should begin within a period of several days to 35 days after myocardial infarction and from 7 days to 6 months after ischemic stroke. In non-ST elevation acute coronary syndrome, unstable angina or non-Q wave myocardial infarction, treatment should begin within a single loading dose of 300 mg and then continue with the drug at a dose of 75 mg one time per day, with simultaneous administration of acetylsalicylic acid at a dose of 75 to 325 mg per day. Since the use of acetylsalicylic acid in high doses is associated with a greater risk of bleeding, the recommended dose should not exceed 100 mg. The course of treatment is up to 1 year. In acute ST segment elevation myocardial infarction, the drug is prescribed at a dose of 75 mg one time per day, using an initial loading dose in combination with acetylsalicylic acid with or without thrombolytics. For patients over 75 years of age, treatment with clopidogrel should be carried out without the use of a loading dose. Combination therapy started as early as possible after the onset of symptoms and continued for a minimum of 4 weeks. Contraindications: hypersensitivity to the active or any auxiliary components of the drug clopidogrel, severe liver failure, active bleeding, including peptic ulcer bleeding or intracranial hemorrhage, pregnancy and lactation, age up to 18 years, efficacy and safety of use have not been established, lactose intolerance, lactose deficiency, glucose-galactose malabsorption syndrome. Special instructions: clopidogrel should be used with caution in patients with an increased risk of bleeding due to trauma, surgery, other pathological conditions, diseases predisposing to bleeding. The simultaneous use of clopidogrel and warfarin is not recommended, as it may increase the intensity of bleeding, with the exception of special rare clinical situations. Due to the possibility of dizziness when taking clopidogrel, care should be taken when driving vehicles. Clopidogrel side effects: clopidogrel increases your risk of bleeding, which can be severe or life-threatening. Call a doctor or seek emergency medical attention if you have bleeding that will not stop, if you have blood in your urine, black or bloody stools, or if you cough up blood or vomit that looks like coffee grounds. Also call a doctor at once if you have nosebleeds, pale skin, easy bruising, purple spots under your skin or in your mouth, jaundice, yellowing of the skin or eyes, fast heartbeat, shortness of breath, headache, fever, weakness, feeling tired, little or no urination, aphasia, low blood sugar, headache, hunger, sweating, irritability, dizziness, fast heart rate and feeling anxious or shaky, or signs of a blood clot, sudden numbness or weakness, confusion, problems with vision or speech.